I will be doing my presentation on paraphilic disorders. Where does it begin? Most paraphilias emerge during adolescence. A combination of neurobiological, interpersonal, and cognitive processes all play a role. Evidence suggests that central dopamine plays a key role in the pathogenesis of paraphilic disorders and the general disturbance of the conscious regulation of behavior. A study revealed that increased levels of serotonin and norepinephrine, with a decreased concentration of DOPAC in urine samples of the test population diagnosed with paraphilic disorders. One or more events occurred during childhood that led the individual to associate sexual pleasure with that event. And then, fun facts, a majority of people with paraphilic disorders are men. Paraphilic disorders affect less than 2.3% of the population, and there may be as many as 549 paraphilias, give or take. So our first one is celebrophilia, which is the pathological desire to have sex with a celebrity or famous person. This may involve the need to stalk these celebrities and either observe them voyeuristically or try and approach them and have sex with them. Some just want to masturbate to photos of them. People with celebrophilia are not considered groupies because groupies develop crushes, while on the other hand, people with celebrophilia have a desire for the person's fame, not the celebrity itself, in some cases. So there was a murder case around this. Specifically, I just want to talk about Bonnie Lee Bakley, who was the one who was shot and killed in her husband's car on May 4th, 2001. Her husband, actor Robert Blake, was suspect number 1, but he was exonerated of all charges, and since then that case has gone cold. But Bonnie was a prime case of celebrophilia, seeing as though she had talked and conned many other celebrities throughout her life. She also did this to other men as well. She talked to celebrities such as Dean Martin, Jerry Lee Lewis, and Robert De Niro. She actually had stalked Jerry Lee Lewis for a couple of months before she had become friends with him, but that friendship ended in 1984 because Bakley was lying about being pregnant with his child. Our next one here is dendrophilia, which is the sexual attraction to trees and other large plants. Trees may become symbolic of sexual stimulation, or just an image of a tree may be seen as phallic or arousing. Others may just be turned on or enjoy having sex in the woods near trees, but some people may prefer a specific type of tree while most don't have a preference. Foliage and shrubs are also something that people get aroused by. Some use the holes in trees for penetration. Some find arousal from just rubbing up against a tree. Some don't want to be physical with the trees, so they get their arousal from having sex or masturbating while among the trees. Dendrophilia actually starts out as just a love for trees, so it translates to love for trees, but we took it a step farther and made it a sexual attraction to trees. So this can be presented by a sincere respect for trees or a desire to protect and care for them. This can also be known as arbophilia. They find solace and connection being amongst nature, and they like to plant trees, grow trees, and nurture trees. Our next one is gerontophilia, which is the sexual attraction towards the elderly. Most people with gerontophilia have problems being attracted to people their own age. They may get excited just by being in the presence of older people, so an old person walks into the room, you're automatically aroused. They can only fantasize or masturbate when thinking about seniors, and can just be sexually aroused by vision or contact with elements that remind them of older people, such as canes, wrinkled skin, or white hair. I did find some causes to gerontophilia because I feel like a lot more people are open to saying that they're into elderly people, so we have a little bit more research on it. So this number one reason or cause is the need for protection. We associate old people with things such as protection, security, or well-being. The sense of protection from someone can then lead to arousal. Number 2 cause was trauma. After a child has been sexually abused by an adult, their subconscious might associate sex with the presence of an older person. And the 3rd cause is the search for the extreme. Some people just want to experiment with new things that are totally remote from what the normal is. People with gerontophilia have to be aware that if they are seeking out this intimacy with an elder, that the elder is consenting to doing those things with them. Just because as an elder person, they may not be in the right state of mind. They're aging backwards at that point, so you just have to be aware that they are aware of what they're doing and they're consenting to it. The next one is trichophilia, which is the sexual arousal from hair. People have a hair preference that once they see it can give them instant arousal. For some people that's short curly hair, for some people that's long straight hair, vice versa, all good combinations. Some people prefer color, red hair, blonde hair, all of that. They may wonder what it smells like, what kind of shampoo they use, and how it would feel on their skin. They get aroused by stroking, brushing, or washing someone's hair. And most people talk about the softness of someone's hair and how they love it. There are many ways that hair can be used to pleasure someone in the bedroom. And I did a lot of research on this, and I'm scarred from the amount of different ways that people can use hair in the bedroom. Moving on. Next one is spectrophilia, which is the sexual attraction to ghosts, which I think this one's my favorite. I don't know. It's just, so, like, out of the ordinary. I don't know. The main sexual outlet for people with spectrophilia is masturbation, seeing as though there's not a physical aspect with ghosts. Some may leave their windows open so a ghost can come on in, and some may seek out haunted places to get arousal. Many people have said that they have had sexual encounters with ghosts. Sometimes this is associated with sleep paralysis, where they experience seeing or feeling an evil spirit in the room with them. Some people believe that they hallucinate these encounters due to pent-up sexual frustration. Now, here at the bottom, two different things. A succubus, a demon that takes female form to appear in dreams to seduce men, and an incubus, a demon that takes male form to appear in dreams to seduce women. This is the differences between cultures. With celebrophilia, in Western cultures, celebrities are looked up to a lot. Unlike in other cultures with celebrities are just people like the rest of us. With dendrophilia, in other cultures, they believe that trees are a symbol of fertility. So they would practice specific sexual rituals with trees. Sometimes there would be no physical contact, and other times there would be. With gerontophilia, a lot of cultures tend to respect their elders and pair people up with older people for their knowledge and protection. In Western culture, we frown upon these old-young relationships, and we even still have trouble respecting our elders. Trichophilia, in some other culture, hair is a very sacred thing. In Muslim cultures, women cover their hair to maintain modesty and privacy. In Pentecostal Christians, they refrain from cutting their hair because hair is a sacred gift and part of a woman's glory. Spectrophilia. In other cultures, the dead are a very secret thing. Just look at Dia de los Muertos. They still believe the dead are there with them and their loved ones are always watching over them. Some treatments. I was able to find an algorithm that classifies these treatment plans according to their level of severity. So level 1 would be mild, and level 6 would be catastrophic. So starting off with mild, level 1, treatment with cognitive behavioral therapy regardless of the severity. People with paraphilia should be treated with therapy. Level 2, treatment with selective serotonin receptor inhibitors, SSRI. Level 3, if symptoms fail to get better with the SSRIs within the first 4 to 6 weeks, then you would add a low dose of medroxyprogesterone in PA or cyproterone acetate CPA is recommended. Level 4 includes treatment with full dose of oral anti-androgen therapy. Level 5, long-acting intramuscular hormonal treatment is advised. And level 6, which is catastrophic, if a patient failed treatment above, then they require complete androgen suppression with a higher dose of IM and/or adding additional hormones like luteinizing hormone release hormone, LHRH. So that's my presentation. I hope y'all enjoyed these different paraphilic disorders and paraphilias. There's even more weirdo ones out there. I just chose the ones that I found most interesting. If you want to go tell a friend about these, just randomly bring them up in a conversation, see the reaction to it. Feel free to. I think that would be funny and just like be a menace, you know? And then these are my references. Thank you.